Age-related macular degeneration. Age-related macular degeneration, or ARMD, is the leading cause of visual impairment and blindness in older population. ARMD is a disease caused by the progressive degeneration of the macula. The macula is an area of the retina that is responsible for our central vision. There are two forms of macular degeneration, the dry form or the wet form. Dry ARMD is characterized by the presence of these small, round yellow deposits, known as drusen, that are found underneath the retina. Drusen is composed mainly of fats and proteins due to an accumulation of waste products from cellular activity. A few of these small drusen may not cause changes in central vision. However, as they grow in size, increase in numbers, and coalesce with neighboring drusen, an individual's central vision will be noticeably compromised. As the degeneration advances, macular atrophy or retinal tissue death occurs since there isn't enough nutrients getting there or any more UV blocking agents. The wet form of this disease will occur after the atrophy phase of the retina. This form deals with the growth of small abnormal vessels that leak blood or fluid into the macula. In early stages, ARMD is entirely asymptomatic but can still be detected by your eye care professional. The most common initial symptom is slightly blurred central vision when performing tasks that require seeing fine detail. As the disease progresses, the blurred area will increase in size, where it will start to interfere with reading and recognizing faces. Other ARMD symptoms are straight lines looking wavy or distorted and dark spots being faded out in portions of your central vision. If it progresses to the advanced stages, then permanent loss of central vision will be apparent. However, peripheral vision will still remain unaffected. There are many risk factors for this disease, such as age, family history, smoking, sex, and race. Talk to your eye care professional to see if you are at risk or have this disease. Amblyopia. Vision is a learned process that requires ideal conditions for proper development. If the brain receives abnormal or unequal visual input during infancy or childhood, it results in a condition known as amblyopia or lazy eye. A child with amblyopia doesn't develop the proper nerve pathway, as opposed to the unaffected eye that has developed more nerve pathways to the brain. As a result, the amblyopic eye will send fewer neuroelectric signals to the brain than the good eye. If left untreated, the pathways through which these signals travel may weaken and not develop properly, damaging the child's vision. Amblyopia is a loss of vision in one or both eyes that develops before the age of 6. It is caused by either an eye turn, a deprivation, or from refractive errors. Amblyopia affects the efficiency of the visual system as the patient loses their binocularity. Patients with amblyopia have reduced depth perception. It impacts one's reading and learning, sports abilities, and navigating through one's surroundings. Treatment options include a combination of eyeglasses, drops, vision therapy, and/or eye patching. During vision therapy, the patients learn to use their two eyes together as a team. Amblyopia can be diagnosed during a comprehensive eye exam. Early detection and treatment of amblyopia is an important strategy against preventing vision loss. All children should have a complete eye exam at least once between ages 3 and 5. The sooner children get treated for amblyopia, the better the prognosis is, since the child's brain is highly plastic. Diabetes. Diabetes is a systemic condition that affects many parts of the body. One of the first areas that diabetes affects is the kidneys and the eyes. However, changes can be seen in the eyes but not for the kidneys. Diabetes affects these organs first due to their small microvasculature system. The eye doesn't actually see objects. Instead, it sees reflected light from the objects. The reflected light enters your eyes to land on the retina. The retina is the structure that converts light into an electrical signal and transmits that signal to the brain through the cable called the optic nerve. The brain processes the signal into the image that we see. In order for the structures of the eye to function properly, there needs to be an efficient vasculature system that brings oxygen and nutrients to these components of the eye. One of the most common eye problems for patients is a condition called diabetic retinopathy. Diabetic retinopathy deals with high levels of sugars in the bloodstream that damages the tight junctions of the inner lining of blood vessels. In early stages of the disease, the damage to the blood vessel lining will cause leakage of blood, plasma, and exudates or proteins. As a result, it may generate infarcted areas or areas of swelling that may or may not affect the vision. As the retinopathy progresses, the perfusion of blood to the retina depletes, causing hypoxia. Thus, the body will release VEGF to stimulate the production of new fragile blood vessels in an attempt to increase oxygen and nutrients to the retina. These fragile blood vessels, known as neovascularization, are more susceptible to breaks and bleeds. If blood is found in the eye, then it will impede light rays from reaching the retina, causing vision to decrease. If these blood vessels grow anteriorly into the vitreous, it can cause a retinal detachment that can make a person go blind. This is why it's important to monitor diabetes and detect subtle signs so we can prevent progression. Most of the time, patients with diabetic retinopathy will be asymptomatic. It is important to have a dilated fundus exam or digital imaging of the retina. If you have any questions, talk to your eye care professional, or for more information, visit our website. Glaucoma. Glaucoma is a disease that gradually and silently steals your vision without you noticing until it's too late and permanent vision loss is present. It is usually seen in the elderly population over the age of 50 but can arise earlier. Glaucoma is a disease that relates to high intraocular pressure that damages the optic nerve of the eye. This pressure is dictated by the efficiency of the drainage system. In the eye, a clear fluid is produced and flows towards the front of the eye so it can nourish tissues. At the angle where the cornea and iris meet, the fluid flows through a spongy meshwork and leaves the eye through blood vessels. In an eye that has glaucoma, more fluid is produced or it passes through the drainage system too slowly. With nowhere else to go, this fluid builds up in the front of the eye, causing an increase in pressure. Over time, this increase in pressure transfers to the rest of the eye, where it will affect the optic nerve in the back. The optic nerve head is the cable that connects the eye to the brain, thus allowing visual information to travel from the eye to the brain. The optic nerve is the weakest area of the eye and is most vulnerable to damage from this elevated pressure. Continuous elevated pressure or spikes in pressure can damage the optic nerve, leading to vision loss. If untreated, the painless vision loss progresses from normal vision to gradual loss of peripheral or side vision and eventually leading to a total loss of vision. Glaucoma has many risk factors, including family history. Talk to your professional eye care provider to see if you are at risk. Myopia, or nearsightedness. Myopia, or nearsightedness, means that you can clearly see objects that are close to you, but distant objects are blurry. Myopia occurs when the eyeball is larger and has a longer axial length than an average eyeball. It can also occur from the cornea and/or lens being too curved or strong for the length of the eyeball. Since the eye is longer and/or stronger than the average eyeball, the light that enters through the pupil will focus in front of the retina rather than directly on the retina. Myopia typically begins in childhood and may have a higher risk of progressing if there is a family history of nearsightedness. Most of the time, myopia stabilizes in early adulthood, but sometimes it may continue to progress with age. Fortunately, myopia can be corrected and even slowed down with new modalities. Your doctor will talk to you about the different options that may be right for your eyes.
Lens accommodation. Lens accommodation is when the optical power of the eye's curvature changes in order to focus on objects at a range of distances. The lens is flexible and has a curvature controlled by ciliary muscles through zonules. First, we must identify some of the key anatomical structures of the eye. retina, ciliary muscles, zonules, iris, cornea, pupil lens, and choroid. Changing in curvature. When ciliary muscles contract, the zonules loosen, creating a rounder-shaped lens and a higher refractive power, which enables us to see at shorter focal distances. When ciliary muscles relax, the zonules increase in tension, creating a flattening of the lens, thus an increase in further focal distances. This entire process is called lens accommodation. So why do we need glasses as we approach our 40s and 50s? As we grow older, objects that are close tend to become harder to focus on. This is called presbyopia. As we age, our lens becomes stiffer. This stiffness makes it harder for our ciliary muscles to change the lens shape. Slowly, our full range of accommodation becomes narrowed. This process gradually starts in our 20s, but is so minute that we do not notice it until it starts to affect our daily routine. Though the capabilities of our vision become more limited, presbyopia can be treated with a variety of solutions like corrective lenses, such as glasses, contacts, or surgery.
Presbyopia. Presbyopia develops when our eye's natural lens loses its flexibility and focusing capability for up-close things. The eye's ciliary muscles contracts, causing our flexible lens to thicken and change shape for the specific working distance where the object is held at. This change in shape allows us to see objects up close, which we call as accommodation. Aging will cause our lens to become less flexible and resist changing in shape, thus diminishing our ability to see up close. Usually, the first sign of presbyopia is the need to hold a newspaper or other reading material at arm's length to be able to read them. The best way to fix this problem is by using corrective eyewear or contact lenses. Your doctor will talk to you about the different options that may be best suited for your eyes. Scleral lens. There is a special kind of contact lens out there that is helping many people with corneal diseases, dry eye, and high astigmatic patients achieve clear and comfortable vision. These lenses are called scleral contact lenses. These are large diameter gas-permeable lenses that gently rest on the white tissue of the eye, called the sclera. Since these lenses are supported on the sclera, they completely vault over the cornea, which is the clear tissue at the front of the eye. By vaulting the cornea, scleral lenses provide a clear optical uniform surface that replicates a normal corneal surface. This is created through a reservoir of fluid being held in between the lens and the irregular corneal surface. This helpfully restores vision and creates a smooth, regular refractive surface. Individuals suffering from irregular corneas, such as keratoconus and pellucid marginal corneal degeneration conditions that affect the tear film, and patients with refractive error, such as nearsightedness, farsightedness, astigmatism, and presbyopia that are unable to wear other forms of correction could benefit from scleral lenses. Corneal irregularities can also sometimes result from surgeries, such as corneal transplants and refractive surgery. Scleral lenses are also useful in the treatment of severe dry eyes. It helps with dry eye by keeping the cornea bathed in a preservative-free saline solution, which directly helps to rejuvenate the ocular surface and provide all-day moisture and protection from desiccation of the cornea. If you would like more information, please talk to us to see if you're a candidate.